You're watching Let's Chat.
Next on the table this morning, a couple of friends from the Vascular Institute of Chattanooga. We have Carrie Albritton here. Carrie, good to see you, along with Dr. Will Harris, both with the Vascular Institute of Chattanooga. Topic today we're going to talk about is varicose veins. In a nutshell, what are they?
So varicose veins, you might have seen them walking, around the mall. You look down and see a big bulging vein on someone's leg, those little ropey veins. A lot of times they can just be, visually unpleasing to the eye, right? But a lot of times they can cause a lot of symptoms as well. So really what happens is the veins in your legs become enlarged. They get too big. And when that happens, some of the blood flow actually starts pooling down in your leg and can cause a varicose vein and associated symptoms, pain, heaviness, swelling in your legs, things like that.
What's the treatment for these?
There are a lot of different treatments. So a lot of times we'll burn the offending veins that create them. It's all very, very minimally invasive. So the biggest incision on any of the procedures we do is about this big. Sometimes we'll put a catheter in that heats up to high temperature, burns the inside of that vein. Sometimes we'll inject some foam into the veins to close them down. They create disappearing tricks. Sometimes Carrie will inject the very, very small spider veins with a fluid that actually irritates the inside of the vein, closes them down. And then there's some deeper systems. Sometimes there's the big veins that drain our legs can cause problems, be narrowed, chronically narrowed, and we prop those open with stents. It's all minimally invasive.
What about recovery time when you have these repaired?
It's all minimal recovery. So for a lot of our vein treatments, it's a walk-in, walk-out type procedure. You can come in, the procedures last mostly less than 10 minutes, then you walk right out.
Like any other field, the technology in what you're doing has just grown by leaps and bounds over the past several years. Used to be, you were down for a few days when you had these fixed.
The old days of vein stripping is pretty much gone. Sometimes we do pluck out things, but I have patients who go to work later in the day after we've done the procedures, all the time.
That's an incredible story.
It's pretty neat.
What else do you do at the Vascular Institute?
So we treat all manners of vascular disease, from veins to arteries. Peripheral arterial disease is one of our big focuses. We try and focus on limb salvage, but we also do stroke prevention. We do aneurysm surgery. Pretty much the whole gamut of vascular disease we cover.
It is all related, and you guys are the best in the business at what you do. No doubt about it. Back to the varicose veins for a moment. How do you know when you have one? I mean, is there, you hear about self-exam for breast cancer, you hear about self-exam for this and for the other. How do you know when you might be needing to get concerned?
So I ask patients to look beyond just looking down at their legs, like you bring up the breast cancer screening. Yes, you can look at your legs and see if you notice any bulging veins. But beyond that, really ask yourself on a day-to-day basis, when you're sitting or standing for a long time, are you having any significant lifestyle limiting symptoms in your legs? That's what you really want to ask.
Leg pain should not be normal.
Yeah.
Wounds on your legs that don't heal should not be normal. It's always a vascular problem, almost always a vascular problem if they have wounds on their legs, bulging their legs, swelling, cramping. It's always a vascular problem.
And like so many other things, the earlier it's detected, usually the easier the treatment.
100%.
All right, you guys just recently got a pretty cool accreditation. Tell me about this.
Yeah, so we recently got accredited with a national accreditation committee. So it's IAC, Intersocietal Accreditation Commission. They're widely known nationally for giving accreditation to various clinics. They've accredited over 14,000 sites. So we recently just underwent a very grueling application process and site visit where we were accredited to essentially treat patients in the community for superficial vein disease and for deep vein disease as well.
So we're the first in the state of Tennessee to do all the deep venous system as well as the superficial venous system. They also accredit our vascular lab, and it's a continuous process. So they'll revisit us throughout the years and things like that, and it's pretty exciting, pretty neat.
Dr. Chris Lassar has always had the reputation, well-deserved, of not just treating the patient, but the patient's family, and aftercare on this is so very important.
The thing is once a patient is established with us, they become part of our family. We want to take care of them like I would for your family or my family or anything else. And so,
sounds good.
And we work together as a family. It's fun.
Well, Carrie, we got to leave it there. You guys are always welcome back anytime. Vascular Institute of Chattanooga. Check them out. Give them a call for more information. VascularInstituteOfChattanooga.com, the website. VascularInstituteOfChattanooga.com.